How does a clinical breast exam complement mammograms? Imagine catching a small change in your breast that a mammogram might miss. That's where a clinical breast exam can play a helpful role. A clinical breast exam is a physical checkup performed by a healthcare provider who carefully feels your breasts and underarm areas for lumps, thickening, or other unusual signs. While mammograms use X-ray images to look inside the breast tissue, a clinical exam adds a hands-on approach that can sometimes detect issues that imaging might overlook. Mammograms are the main tool used for breast cancer screening because they are highly sensitive, especially for women over 50. They can identify tiny tumors before they become noticeable. However, mammograms are not perfect. They can miss about 6 to 8% of cancers, particularly in women with dense breast tissue. Dense tissue makes it harder for the X-ray to distinguish tumors, which is why additional methods can be valuable. This is where the clinical breast exam comes in. It can be especially useful for women in their 40s and 50s, or those with dense breasts, where mammography sensitivity is lower. When a healthcare provider performs a clinical exam, they might find a lump or change that is not yet visible on the mammogram. In women aged 50 to 59 with dense breasts, adding a clinical exam can detect about 2 to 6% more invasive cancers beyond what the mammogram finds. That small increase can sometimes make a difference in early detection. However, it's important to remember that the clinical breast exam has limitations. Its sensitivity is lower than that of mammography, meaning it can miss a significant number of cancers. Studies show that between 17 and 43% of cancers might be missed if only a clinical exam is used. Plus, false positives can happen, leading to unnecessary worry and additional testing. Because of these factors, medical guidelines recommend using both methods together as part of a comprehensive approach to breast health. The clinical exam is especially helpful for women who have dense breasts, are younger, or have symptoms like a lump or unusual changes. It also provides an opportunity for healthcare providers to educate women about breast health and to identify any signs that need further investigation. In summary, a clinical breast exam complements mammograms by providing a physical check that can sometimes detect cancers that imaging might miss, especially in dense breast tissue. It is not a replacement but a supportive tool that, when combined with regular mammography, can slightly improve early detection. Always remember that the best approach is personalized, so talking with your healthcare provider about your individual risk and screening plan is essential. Regular mammograms remains the cornerstone of breast cancer screening, with clinical exams adding an extra layer of vigilance and reassurance.